welcome. You're watching Medically Speaking and I am Meenakshi. First of all, a very happy Women's Day to all our viewers. Our topic of discussion today is Swasth Nari, Sukhi Nari. A healthy woman is a happy woman. How do we ensure this health as far as women of India is concerned? To discuss this in greater detail, I have a panel of experts. First of all, I'd like to welcome Dr. Madhuri Patel. She is the Secretary General of FOGSI. Dr. Rishikesh Pai, he's the President-elect of FOGSI. Dr. S. Shantakumari, she is the President of FOGSI. I also have Dr. Nandita Palshetkar. She's the President of ISAR. Also joining us is Dr. Rishma Pai. She is a past President of FOGSI. I'd like to welcome all of you on the broadcast. I'm going to start first of all with Dr. Shanta Kumari. Dr. Kumari, help us understand when we speak of this theme, Swasth Nari, Sukhi Nari, what does this exactly mean? Why is it so pertinent that we talk about it today and bring the focus back on women's health and women's wellness?
Thank you very much. That is a very apt question. We bring greetings from FOGSI, the 38,000 strong body of OB-GYNs. We obstetrician gynecologists, FOGSians, are the caretaker of women's health. If there is any voice which is talking about women's health, it is our voice. We are the voice of women in our country, and FIGO is the global voice of women. We take care of our women in all aspects. When you look at our vision and mission of FOGSI, we say FOGSI for all, always, and Dhira, stop violence against women. FOGSI for every mother to reduce preventable maternal morbidity and mortality. FOGSI for every neonate to actually prevent the infant mortality rate, prevent the preventable stillbirth rate, and FOGSI for every woman so that she can live with courage, with health, with Dhira, saying no to violence against women. And of course, our organization is for FOGSians to be able to practice with dignity, with protocols, so that we can deliver the best of care to women. Unless we focus on all the aspects, we will not be able to actually achieve women's health, and that is the only answer to our country reaching the SDG goals 2030, which we are very near. So it's the responsibility of each one of us to take care of women's health, because that is the crux of health of the country. So we have to look at it in that sense.
Right. Of course, the crux of the health of the entire country lies in the health of women. Secretary General of FOGSI. Also, of course, she's a member of the FIGO Preterm Birth Committee. She's also the honorary clinical associate at the Vadia Hospital in Mumbai. Dr. Patel, just to take this thought forward, birth, of childbearing days, how important are they? How significant are they? And how important is it to focus on a woman's health at that point of time specifically, ma'am?
Yeah, thank you, Dr. Meenakshi. And I must thank...
Thank you, ma'am.
Okay. As Dr. Shanta Kumari has mentioned, that FOGSI has a mission and vision of the woman's health to reduce the maternal mortality rate as well as the perinatal mortality rate. And we are into it. The most important part is, the nutrition deficiency in these, ladies. Our ladies who are pregnant in the reproductive age group, they are, anemic. They are having malnutrition. And so most common is the iron deficiency and the folic acid deficiency. So we are, as an obstetrician, we are to take care of our women and the child right from the womb. And, if we give a good, healthy baby, then of course our nation is going to progress and going to become a healthy. So many projects we are doing with the government. We have our own project. We have 27 committees. In that, we have a medical committee, medical disorder committee, public awareness committee. So by this, we are doing, public awareness program. We are doing screening program. We are arranging camp, and our 38,000 plus members are a grassroots level where they are taking care of our ladies and the children. And I must say that recently we had a campaign of the anemia-free India. And we are in the record of the Greenish Group, so that is a campaign we are doing, and we are really making people aware that you should have a healthy food. And let me tell you that anemia is a major cause of maternal morbidity and mortality. and perinatal mortality and morbidity. So if we treat only anemia, we can prevent so many complications like abortion, abruption of placenta, abortion, postpartum hemorrhage. And this is a major killer, and we can definitely reach to our goal of SDG, which Dr. Shanta Kumari has said by 2030, of reduction of maternal mortality rate by less than 70 per 100,000 live birth. And I must say that we all are here together. We are with all the government policy. And, Dr. Shri, Honorable Minister, Dr. Shri Narendra Modi ji has launched this scheme of, fortification of rice with iron and, vitamins and folic acid. And
Yeah.
we want to universalize, this, by 2024, which, 100 crore people will get benefit of our country, and in that 20 crore women will be included of the reproductive age group. So we are moving, definitely we are marching towards the healthy nation. Thank you very much.
Well, absolutely. And it's great to see the collaboration which, you all as an association, as a group also are making to ensure that the women of our country remain safe, remain healthy. Dr. Palshetkar also, ma'am, if I could just take it forward, we are speaking of your goals. Help us understand what are SDGs goals for women's health and how has India fared if we speak of the last 10 years vis-a-vis, of course, your goals. Dr. Palshetkar?
Yeah, hi, Meenakshi. I think, first of all, happy Women's Day to everybody. I think we at FOGSI are treating 50% of the population of India. And so we're really happy to be here to talk about, I think, those salient points which affect women. If you look at the SDG, that is Sustainable Developmental Goals, which the UN Assembly brought about in 2015, there are 17 goals. And the ones which apply to women's health are number 3 and number 5. Which means that everybody should get universal health, especially in our country. What the goal mentioned is the maternal mortality rate. Then a lot of children who die at birth, death of the newborn, and under 5 deaths, when the child is less than under 5. I think those are the markers of a quality care, of the care in your country. And that is what they have set goals, that the MMR, maternal mortality, should be less than 70 women per 100,000, 1 lakh live births. And India, with a lot of effort, the FOGSI has done a lot of projects, emergency medical care. We've trained DIs, we've trained nurses, we've trained paramedical staff and got it down to 113. In fact, the state of Maharashtra, Kerala have gone to below 70. So India is reaching there. Then even the newborn stillbirth rate, which is the aim is 12, and right now we are at 20. And the under 5 death rate should be less, which should be about 30 per 1,000 live births, is reached. In India we have 30, and it should be negligible or less than 5. Now these are preventable deaths. Believe me, FOGSI and the government are working together. And this data is from the Niti Aayog, the UN, the UNICEF. So we are reaching there. And I'm very happy to say, I think the government, especially this government, has launched a lot of schemes like universal healthcare for all. I think it's going to help women. The second point is gender discrimination, the fifth point, which is there for women. I think on Women's Day, we should address this goal because it believes in female ratio to the males has improved according to the latest NHS survey. We have 1,023 women to 1,000 men in our country. And that, I think, is an achievement because of the drive of Beti Bachao, and now we are going on to say, Beti Bachao, Beta Padhao. As Dr. Shanta Kumari has said, Dhira, no violence. So we have to educate the boys. Discrimination, workplaces. If you can look at this panel, we have 5 women and there's only 1 man. I think the leadership qualities of the women are coming up. So I feel very, very energized about what India is doing with the SDG goals. And I think we have done a lot of progress.
Well, since you spoke of the man in the panel, I think it's only fair that the male panelist as well. It should not look like it's, Women's Day is not just about women. It's really about collaboration where men also speak up and, contribute when it comes to equality and, of course, health of women as well. So, Dr. Pai, of course, the next question coming to you. Since we're speaking of how FOGSI has been, working with a lot of government schemes, you have the Pradhan Mantri schemes, many other schemes, which all of the panelists have also spoken about. Help us understand really, for the public sector, what all FOGSI is doing, all the collaboration which you've made with the government of India as well, and your future programs as well, Dr. Pai.
Thank you. First of all, happy Women's Day to everyone in the panel and for everyone. For the men, if the women are happy, we are happy. So it's very important day for men as well. And, there are many schemes of the government, but two main schemes which I would like to focus on is in 2016, we launched the Pradhan Mantri Surakshit Matratva Abhiyan with the government of India and the Indian Medical Association. And that has really done well. It was a simple scheme launched by our Prime Minister, and that was to give free antenatal checkup on the 9th of every month. And that scheme has really worked. It has covered nearly 2.5 crore women over the years, and more and more. And in that, FOGSI, our Federation of Gynec Societies of India is FOGSI. We have 38 to 40,000 members. So many of the members volunteer. They are private practitioners, but they would also like to help our poor people, and many of them have volunteered for this scheme. So this is very important scheme, and the modification of the scheme was the Suman scheme, which was launched in 2019, which is Surakshit Matratva Ashwasan. So now they have modified the scheme, so any woman till 6 months after delivery, everything is free. So much so that they pick up the person from the house and put them in the hospital and again drop them to the house. And even the newborn care is free. So it's a fantastic program. And the other program, which we are also a pet program of the Federation, is the Manyata program, where we have upgraded the nursing home. So nearly 1,500 nursing homes have got upgraded now. We have got trained them, we have certified them, we are updating them. And this has been a joint program with the Makata Foundation, the MSD for Mothers, which are international organizations, and our Japaigo, and our lot of inputs have come from local governments as well. And this has actually led to better delivery services, increase in the vaginal births, trying to decrease the cesarean births. All these are very good contributions to that scheme. So these are some of the important schemes which we work. So public-private partnership, because India is of two Indias are there. One is the 300 million India and the other is the 900 million India. We have to take care of both India, and the women in both India are very important to us.
All right. So since you spoke of two Indias as well, and Dr. Rishma Pai, if you could come in here as well. In urban areas as well, forget rural areas, there is very less awareness when we speak of regular checkups, perhaps even like a pap smear. Why do you think that the awareness level is so low, and what we can do to increase awareness level in both these Indias which Dr. Pai spoke about, perhaps a rural and urban India?
Thank you, Meenakshi. Happy Women's Day to all. And this is an opportunity for us to actually focus on very many important issues of women health, some of which we've already spoken about, and some which are literally crucial to the life of women, and that is cancer prevention. And cancer prevention can only happen if there is awareness. Unfortunately, we said the urban as well as the rural India, even amongst the educated, cancer awareness is very, very low. Do we know that we are unfortunately one of the leading countries? 30% of the world's load of cancer is unfortunately in India. In India, every 8 minutes, one woman dies of cancer of the cervix, which is the mouth of the uterus. And it's a pretty preventable cancer. This is one of the few cancers which is caused by an infection, by human papilloma virus. It is normally a sexually transmitted infection because of low immunity, because of exposure to multiple partners. If we could just spread this awareness, if we could actually test for this human papilloma virus, even if we were to just examine a woman, just look at the cervix, we would be able to diagnose many of the cancers. Of course, there is pap smear screening available freely across the country, absolutely free of cost in most of the government hospitals, which will help us to diagnose cancer of the cervix very early. And obviously, any cancer which is diagnosed early can be treated very safely. Not only that, there is even a vaccine available today, the HPV vaccine, which if given to young girls will really reduce the incidence of their developing cervical cancer later on in life. Of course, cervical cancer is one of the most important cancers in India, but the most common is actually breast cancer. Again, minimum awareness about breast cancer. Every 13 minutes, one woman dies of breast cancer in this country. So, breast cancer, all you need is a monthly breast self-examination. So even if this simple awareness every month, maybe after the period, if the woman examines the breast, she picks up any lump, she can immediately go to the doctor. And the moment a cancer is diagnosed early, it can be treated. So also cancer of the all diagnosed by a simple examination by a gynecologist or by a simple sonography, many of which are available. So I think we have to really spread this awareness on occasions such as Women's Day, when we can, talk about all these events. That's the point of Women's Day, to focus on issues of women's health, equality, on, to sort of highlight issues which women go through. And cancer, obviously, in women is one of the most important issues.
Well, absolutely. The idea of programs like this are also to increase awareness. And, since we are speaking about increasing awareness, FOGSI has been really at the forefront of it, isn't it? Dr. Shanta Kumari, if you could just come in here. End of the day, women's health isn't just about physical health, it's also mental health. And you have really worked a lot when it comes to reduction of violence against women, perhaps even improving the sex ratio. Help us understand, all the work which FOGSI has been doing, and what are your plans going ahead, Dr. Shanta Kumari?
Thank you, Meenakshi. That was a very pertinent question. We do understand that violence against women has got a far-bearing effect on the women's health. If we are able to reach the best of health, it should be that all of us partner together to say no to violence against women. World over, global statistics has shown it's more than 35% in every part of the globe. And India is also one of them. And we know, why is it that obstetrician gynecologists, we need to talk about violence against women? Because violence has an effect on women's health. Violence has an effect on us reaching the MMR goals. If we want to reduce the maternal mortality and morbidity, we have to address this issue. And COVID pandemic has actually shown the globe that violence affects women in all forms, because it's any sort of physical, mental, sexual violence are all violence against women. And what is it as obstetrician gynecologists we are doing? We are the first point of contact for women. When a woman has a problem, whom does she turn to first? She doesn't go to the police or to the lawyer or anyone else. She actually comes to her friendly OB-GYN, her friendly doctor, Amma. So that was the reason why we thought, when I was a member of the FIGO working group on no to violence against women in 2015, I said, we need to come out with a campaign. And I initiated Dhira. Dhira, which means courage, which means say no to violence against women. We started as an advocacy. We partnered with the police, the SHE teams. We partnered with the National Commission for Women. And most important, we have to partner with men and society at large. So we started off with campaigns, cyclothons, bikeathons, walkathons. We have involved celebrities. We have done radio shows, TV shows, and public awareness programs. We are trying to sensitize everyone. Most important are the women and men of the society. This campaign, I've been able to take it not only in our country, but globally, even at the FIGO Congress in Rio. And we have done this Dhira campaign. That's where I realized that world over, the problem is there. And all OB-GYNs across the globe are committed to reduce the violence. And Meenakshi, I would like to tell you, this year when I took over as the president FOGSI, the focus was, the idea is, how do we actually achieve a gender neutral society? We have to catch them young. We have to catch the young minds. So I have actually conceived this Dhira online certification course in partnership with UNICEF India. The idea is, we are doing a 2-hour certification course for our children. It's a simple online course, and at the end of the course, they get a certificate. We are talking about the ill effects of violence. We are talking about how everyone should partner, so that no girl should actually grow up when she sees her mother or someone getting affected. She should not think it's okay.
Yeah, and you rightly mentioned, ma'am, it's very important to not just talk about women's health, but also to cater to these issues. Dr. Madhuri Patel, since we're speaking about violence against women, mental health, mental trauma also very, very significant, very important. Help us understand on this Women's Day the importance of mental health as far as women are concerned.
Meenakshi, the mental health, when you say that involves the emotion, psychological, all this well-being and the social well-being there. If the physically a woman can be healthy, but mentally she is not healthy, then her whatever she does, it is not going to come, to her best. So the mental health gives, the confidence to the women, then it gives a women, to cope up with the stresses. Then she has a positivity every time. Yes, if her mental health is good, whatever work she does, she will be, very confident about it, and therefore coping up with the stress, coping with up the surroundings, mental health is very, very important thing. And a woman, when she suffers from mental health, she has to have a positive attitude that yes, whatever it is, today it is this, tomorrow it will be better. Today, whatever I have achieved, it is the best, Another, the women should have a gratitude, whenever they achieve something, should be to mentally that yes, since I'm going to achieve more. Then you have to move around with the people who are like-minded. You can't move with the people who have a negativity. You have to move with the positivity. And of course, there are many, many things are available. Then you can, how to cope up with the stress. We have some meditation. We have some, hobbies you can develop. Then we, of course, have a job. That is the last step we take. But we can develop our hobby, and you remain in that. You have a positivity, and your mental health and the physical health can give the best to yourself.
Right. And, health of women, I personally think it's very unfortunate. It's very much tied up to our fertility as well. A fertility of a woman, very unfortunately, in our society also determines her worth. Rather unfortunate, but Dr. Nandita Palshekar, since you're the president of ISAR, you're also a member of the FIGO HSS RC committee. You're also a consultant and Leelavati, and one of the biggest hospitals in Maharashtra. There, Dr. Palshekar, help us understand really where do we stand as far as infertility is concerned? Why is it till date we attach a woman's worth to her fertility? And when it comes to pregnancy also, we can nowadays detect genetic anomalies. Is that awareness, has it already happened when we speak of urban and rural India, ma'am?
Yeah, I mean, actually, just to digress a little bit, we were discussing about the maternal health and mental health and VIDA, violence against women. I think what is most important tenor, which actually binds women's health, is respectful care. And that is what the world has realized, that unless we give respectful care to our women, they don't trust us and they don't come. And it is a very, very important part. And, I'm on the Federation of International Gynae-OBGYN Society, that is FIGO, member of the Health Strengthening Systems and Respectful Care. And we are doing a lot of projects. And the whole tenor is that to get all these, Rishma spoke about cancer, all these things, the women have to get respectful care because that is what they want. Yeah. So you are talking about the urban and the rural women. I think if we give them confidence in their health givers, if we give them a lot of respect, they will come. And that would be really, really important. And that is what we are doing through FIGO, FOGSI, and the government of India, where they have what Dr. Pai spoke about, Manyata, Lakshya Manyata programs, etc. If you come to infertility, I think when I took over, really, there are 40 to 80 million couples in the world who suffer from infertility. And would you believe it, 25% of them are in our country. And, in fact, WHO has classified infertility as a disease. It's a non-communicable disease if you go to see. But it has a lot of social implications, as you said. The women feel inferior, they're treated differently. But there's a lot of change which has come because of education, awareness, where the male is also responsible 50% for causing infertility. So now I see couples who come together to me for consultation of fertility. And many causes, female, male, there are multiple causes, and we do treat them. And most of the treatments available are simple. We treat, let me tell you a simple thing. Out of 10 women, 2 women would be treated with just medicines. 2 women would need surgery. And maybe 6 women out of 10 would require the different high technologies like IVF, test tube baby, etc. But let me tell you that these technologies have a success rate today, which is like 50%, in the younger age group. My urge to women today is to spread this awareness that take help quickly. I get patients who come after at the age of 40 that, oh, nothing is wrong with us, and they're moving from here
Yeah.
to there. So I think this is important. The other point about genetic is today, no child should be born with mental retardation due to Down syndrome. There are tests. We do blood tests, we do sonographies, which can help us identify these problems in the children.
Mhm.
And also now is the era of preventive medicine. We are talking about prevention of cancer, prevention of violence, prevention of a lot of things. I think prevention of genetic diseases is possible. In IVF, we have a technology where we can actually, examine this embryo or the baby before putting it in the womb, saying that it is genetically normal. It is known as pre-implantation. Many technologies are born, who have problems, and hereditary diseases can definitely be prevented. So I think we
Right. Point taken. Point taken. Of course,
rural India.
absolutely, times have changed. The technology is available. We need to avail it. Awareness, seems to be a little bit of a problem, but hopefully by programs like these, we're breaking those barriers. Dr. Pai, since we are speaking of childbearing age or fertility, abortion also very significant topic far as women are concerned. When you compare, India to even Western countries, at least as far as abortion is concerned, our laws are much better. The power of abortion is still in the hands of the woman. Help us understand, a little more about the changes in the MTP Act. End of the day, the show is about empowering women and not ours.
Thank you. The Abortion Act was there since 71. India has been a very progressive nation. But, as we evolved, there are certain hiccups with the Abortion Act, and they have been modified now in 1920. In this 2021, we got a MTP modification was done in the MTP Act, and new things have been incorporated in the Act to give more access to care. Of course, medical termination has become a big thing. So you can now, have early diagnosis of pregnancy, and if it is unwanted, then you can have medical methods of achieving the termination within the first 7 weeks of pregnancy. In our country, though all over the world, they have extended it, but as far as India is concerned, till 7 weeks of gestation, you can have a medical abortion. And the second important thing that has happened is that the time limit has been extended to 24 weeks. Initially, MTP or abortion could be done only till 20 weeks, that is 5 months. But now, for special circumstances like rape or malformed fetuses and all that, after taking a consent of a proper medical board, you can do a termination till 24 weeks. And also till 20 weeks, normally between 12 weeks and 20 weeks, we had to take opinion of 2 doctors before the patient could go for an abortion. Now, only opinion of one doctor is necessary. So, a lot of changes have taken place, and our country is very progressive. Our government is very progressive, and our people are very progressive, I would say.
Well, absolutely. And since you're speaking of progression, yes, ma'am, we're just running out of time. I'll be able to take one last question. And Dr. Rishma Pai has been waiting very, very patiently. I couldn't go to her earlier, so I'm going to give the last word to Dr. Rishma Pai. Dr. Pai, since we're speaking of fertility, of abortion, help us understand, the procedure, what exactly is this freezing of eggs, because there are many women who would like to know more about it, and perhaps you could shed some light on the same, Dr. Pai.
Yes, of course. As science advances, we work for the betterment of the health of women and men. And one of the most important things every couple wants is a child of their own. So, unfortunately, because of various reasons, sometimes it's social reasons, women today are getting married late, they're having children late, maybe because of career reasons, maybe because they don't find the right partner. So, today we have a choice. They can actually go ahead and freeze their eggs. And once the eggs are frozen, it's a standard process hospitals with very good results. Once eggs are frozen for many, many years, they are kept there without any change. So women can come back 10 years later and have a baby of her own, even if she's more than 45 years of age. Freezing eggs, one of which is cancer. Many women, like I spoke about earlier, suffer from cancer. And these women, you can actually freeze their eggs or their embryos, or even a piece of their ovary can be frozen before they go in for chemotherapy or radiotherapy. Totally damage their ovaries, and they won't be able to produce eggs later. Not only women, even men can save the semen or a piece of the testicular tissue for life if they are undergoing any cancer treatment or chemotherapy. Not only cancers, most people are not aware that even diseases such as endometriosis really damage the ovaries and end up with young women having surgeries and literally no eggs in order to have a baby later. So even these women can have freezing of their eggs before they go in for surgery for diseases such as endometriosis. So cancers, diseases, older age group, all can actually preserve their fertility and come back at a time when they're ready to have a child in order to, go ahead and sort of have the fulfillment of motherhood or parenthood. So today we must use the technologies which are available to us. They are, available all across India, as updated as the rest of the world, the technologies we have in India. So it's all about spreading awareness, and we must thank you for giving the opportunity to us to spread awareness about so many important issues, which, really every woman in this country needs to know about.
Well, and as we close the program, I think it should be the contrary. It should be us thanking all of you experts, all of you doctors who have come together, taken out time to speak to NewsX. End of the day, it's been a very riveting conversation. The idea was to spread awareness. I hope we've been able to do some of that. And also as we close, thank you for all the work which you all are doing in tandem with the government, with all the organizations you are representing here today. Thank you all.
Thank you. Thank you so much.
Thank you.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.